Pediatric considerations for fluid balance. As a nurse, one must take important consideration when caring for pediatric patients, especially infants, due to them having high risk for developing fluid deficiency. When assessing dehydration in children, look out for the following signs: increased heart rate, decreased blood pressure, irritability, sunken eyes, no tears when crying, sunken fontanelles, cold extremities, rapid respirations, and a capillary refill of less than 3 seconds. Please note that capillary refill might be difficult to assess in very young children, especially those under the age of 2. Treat first with using oral replacement treatment, such as Pedialyte. This is safer and cheaper than IV therapy. The initial dose should be 50 to 100 milliliters per kilogram over 4 hours. Alternate ORT with other PO fluids. Regarding stools, replace on a 1-to-1 basis or 4 to 8 ounces if fluid volume is unknown. Vomiting is not contraindicated for giving ORT. When giving IV fluids to pediatric patients, please keep a note of the calculations. Calculate the child's weight in kilograms. Allow 100 milliliters per kilogram for the first 10 kilograms. Next, allow 50 milliliters per kilogram for the second 10 kilograms. Then allow 20 milliliters per kilogram for the remaining weight in kilograms. Divide the total by 24 hours to obtain the rate in milliliters per hour. Vomiting in children. When a child is vomiting, you need to withhold feeding for 1 to 2 hours after vomiting, then restart with ORT again. Give 0.5 to 2 ounces of ORT every 15 minutes and gradually increase as tolerated. Diarrhea in children. Hand washing is very important to prevent the spread of infection. If the child is hospitalized, they need to be placed on contact precautions. It's important to note that the brat diet is no longer used or recommended for children with diarrhea. The brat diet recommends using plain, simple foods such as bananas, rice, apples, and toast. Recent evidence has suggested the brat diet is not effective in treating diarrhea.